Knock, knock, knock. Hi, good morning. My name is Sally. I'm a student nurse. Can I please verify your name and date of birth? I'm checking against the wristband and also establishing my patient is oriented to person. Thank you so much, Mrs. Jones. So I am a student nurse and I'm assigned to your nurse today, and I'm going to be assisting with your head to toe physical exam. Is that all right? Thank you. I'm washing my hands and putting on gloves. So with the physical head to toe, what that means is I'm looking at you head to toe. I'm going to be listening to your heart, your lungs, and your abdomen, and just seeing how you're doing today. I have a few routine questions to ask before we get started, just to make sure I'm providing the best care I possibly can. So what day of the week is it today? She answered appropriately, and that means she's oriented to time. Can you tell me where you are? Yes, you're at the Galen Hospital, and that lets me know that you're oriented to place and what brought you in. You need a physical head to toe for work. That is correct, and that also lets me know they're oriented to situation. Are you in any pain today, or any areas that I should be aware of for tenderness? I'm glad to hear that. When you are walking around, do you use anything to help you mobilize? A cane, a wheelchair, just your legs? Okay. What about when you're home? Cooking, bathing, brushing your teeth? Do you do all those things by yourself, or do you have someone help you? It's just you. Great, thank you so much for answering my questions. I'm gonna start looking you over a bit and see how you're doing. I'm gonna try to keep you as covered as much as possible, but privacy has been provided. Please let me know if you have any pain or tenderness or questions while I'm doing my assessment. So I am gonna start at your head. It's important for me to look at you from your head to your toe. When I'm looking at your head, I'm gonna go ahead and part your hair in multiple areas. I'm looking for any signs of infestation, any areas of hair loss, any lumps, bumps, or bruises on your scalp by manually palpating. Any tenderness I should know of with your face? This is where I like to start doing my patient's cranial nerve assessment. For cranial nerves, we do require a couple of supplies: an alcohol wipe, a sensory cotton swab with a soft and a sharp, a tongue depressor, and a pin light. So for cranial nerve number 1, your olfactory, I'm gonna have you close your eyes, and I'm gonna put something with a smell underneath your nose and have you identify it. So go ahead and close your eyes for me. Can you identify what I just put underneath your nose? That's correct, it's an alcohol wipe. For cranial nerve number 2, I'm gonna be testing your visual acuity by bringing out the Snellen chart. I have the Snellen chart right here. I'm gonna have you close one eye at a time and read a line for me. Go ahead and close your right eye and read line 4, and your left eye. For cranial nerves number 3, 4, and 6, I like to combine. Cranial nerve number 3 is your oculomotor, and this is our pupillary light reflex. So I'm gonna have you look straight ahead, and I'm gonna shine my pin light into your eye and look at your pupil's response. For cranial nerve number 4, this is your trochlear. I'm looking at pupillary accommodation. So I'm looking at your pupil's ability to accommodate. I want you to look straight ahead and follow my pin light as it accommodates from the closer and the further distance. I'm also monitoring for nystagmus, which is not present. For cranial nerve number 6, I'm looking at your ocular movements with your abducens nerve. So keep your head still and follow my pin light. We're gonna go up, side, and down. Same on the other side, down, straight, and up. For cranial nerve number 5, we're testing 2 parts. So this is when you bring out your sensory Q-tip. Let your patient see that it has a soft side and then a sharp side. We're gonna have them close their eyes and identify whether the soft part is touching them or the sharp part is touching them. So go ahead and close your eyes. Soft, soft, hard, hard, soft, soft. You can also continue to do this on the arms and the legs for sensory, which is part of your CPE. For the other part of cranial nerve number 6, this is your motor function of your trigeminal nerve with your jaw. Can you go ahead and clench your jaw shut? And now move your jaw to the left and to the right. Great. For cranial nerve number 7, this is your facial nerve. It's really important to test your facial symmetry. So I'm gonna go ahead and have you raise your eyebrows up. Can you close your eyes tightly? Can you puff out your cheeks? Great. All of your movements were easily performed and symmetrical. For cranial nerve number 8, I'm looking at your vestibulocochlear nerve for your hearing. So how I test your hearing is I'm going to, on each side, whisper a letter and a number and have you repeat back. On this side, A7. They would tell me back, A7. Walk around, do the same thing. I'm going to say B4, and they'll tell me B4. Cranial nerve 9 and 10, I like to combine. Cranial nerve 9 is your glossopharyngeal nerve, and cranial nerve 10 is your vagus nerve. Both of these are looking at our swallowing function, our voice control, and our cough reflex. So can you give me a big deep cough and clear your voice? Can you say, ah? Can you swallow for me? We're looking for soft palate, moving upwards. For cranial nerve 11, we're almost done. This is your accessory. So I'm gonna lightly place my hand against your cheek. Can you press against me? I'm gonna do the same thing for this side. Awesome job. Now I'm gonna lightly press on your shoulders. Can you try to shove me off? And now try to resist me. That was cranial nerve 11, the accessory, and our last nerve is the hypoglossal. For this nerve, I'm gonna have you stick out your tongue. Can you move it from side to side, wiggle it around? Thank you so much. That concludes our cranial nerve assessment. For the rest of the assessment, I'm gonna be looking at your eyes, ears, nose, and just kind of moving down. Let me know if at any time you have a question or are feeling uncomfortable. So for our eyes, I already checked your eye reflexes, but it is still important to monitor for perla. I'm gonna take a quick peek into your eyes one more time. Do you wear contacts or glasses? So I'm gonna lightly put some pressure underneath your eyelids. I wanna make sure that your sclera is white and yet your conjunctiva is light pink and moist. I'm looking for any excessive drainage, which I'm not seeing. I wanna make sure your pupils are doing what they're doing. So I do have my pin light here. I'm gonna be looking for pupillary constriction. And then can you focus on my pin light as I bring it back and forth for accommodation? So pupils are equal and round. They reacted to light and they accommodate. I'm gonna take a quick peek into your ears. I'm looking for any excessive wax buildup or drainage, looking for skin breakdown behind the ears. I'm gonna do the same thing to this ear. I'm gonna lightly palpate with my fingertip and my thumb for any tenderness on your tragus or your meatus. Any tenderness or pain as I lightly touch you? Good to hear. I'm going to move into your mouth area as well. Can you open your mouth please and say ah? So her teeth are intact, her mouth looks moist, her tongue looks pinky red. I'm not seeing any swollen areas, no patchiness, and her mucosa coloring is looking light pink. I'm gonna move down a little bit now for your neck. Let me know if you feel any discomfort or pain. Can you go ahead and look to the left and look to the right? Any pain with movement of your neck? I'm also looking for JVD as she's looking. I don't see any JVD present. Can you move your head up and down? Any discomfort there? So right here's your collarbone. I'm gonna lightly press on it, looking for skin turgor. So her neck is symmetrical. Her trachea right here is midline. I didn't see any JVD present and her neck mobility was symmetrical. Her skin turgor indicated that she did have good hydration status. This is also a great time to do the carotid pulse and get that out of the way. With carotid, I'm doing it one at a time. So with 2 fingers, I'm feeling the carotid on her left side and then her right side. Carotid pulse felt good. I'm gonna start moving down to your arms and your fingernails. We are doing this bilaterally. Let's see if I can move my camera a little bit. So when we're looking at arms, back of the hand is how we test for temperature. We wanna make sure our patient is warm. We're looking for lesions, any tattoos. Arm hair should be present and evenly dispersed. We're gonna look at our patient's hands. We're looking at their palms. No signs of skin breakdown. Her nails are evenly trimmed. I'm checking capillary refill on each finger, and they're all coming back within 2 seconds. Gonna do the same thing for this finger. Looking at capillary refill, looking at your nails and your palms. No signs of skin breakdown. Hygiene is good. This is also a great time to go ahead and do our pulses of the arms bilaterally. So you have your radial pulse on the inside of the wrist for your patient. So I'm gonna go ahead and check that at the same time. Radial pulse feels great. And then your brachial pulse, which is right on the inside of the elbow, kind of that antecubital spot for IVs. and it is 2+ as well. This is a great time to also check my patient's reflexes. I'm getting my reflex hammer. So in our blue boxes, we have a reflex hammer. Have you seen a reflex hammer before? So it looks kind of funny, but it's gonna test your reflexes. I wanna show you, it doesn't hurt, just putting it on your hand. So with our arms, I'm gonna be testing your biceps, your brachioradialis, and your triceps. So just keep your arm relaxed. For your biceps, it's right on the inside of your elbow. We would just tap there, biceps. For our triceps, we're gonna have our patient is right here on the other side of the elbow, kind of right above the funny bone. Our mannequins don't bend, but you've got biceps in the antecubital, triceps right by the elbow. And then our brachioradialis, this is gonna be on the inside, on the thumb side, and you're gonna lightly tap right on the inside of the wrist. For a review, biceps, antecubital space, triceps, right above the elbow, brachioradialis on the thumb side, right by the wrist. I've done your arms, I've done fingernails. I'm gonna go ahead and move into my patient's respiratory. I'm now gonna do our lymphatic assessment. It's important to use light palpation, so we're gonna use just our fingertips, and we're gonna do small circular motions bilaterally if we can. What I'm looking for, which would be abnormal, would be any like enlarged or hard nodes, or if our patient is verbalizing any tenderness. So for our nodes, I am going to begin at our head. There's cervical head nodes, axillary nodes, and then inguinal nodes that y'all are expected to understand. So patient is seated, they're comfortable. Head should be slightly tilted into the side. Again, pads on my fingers for gentle circular motion, bilaterally when I can. I'm gonna start with your preauricular, which is right in front of your ears. Moving to your post-auricular, which is gonna be right behind your ears. Any tenderness there? Right behind the base of the skull, so right around here, you have your occipital node. So I'm gonna feel here for any tenderness. Submental is gonna be right underneath the chin. Submandibular is gonna be all around the jawline. I don't feel anything. We have our superficial cervical, which is going to be right over that sternocleidomastoid. So right around here, which I'm not feeling anything. Our deeper cervical, this requires your patient to help you. So can you lightly tilt your head for me a little bit? I'm not feeling anything. Posterior cervical is gonna be along the back of the neck. So we're gonna go on the, right around here, posterior cervical, back of the neck. Any tenderness? Nothing noted. And then our supraclavicular right above the clavicle. The axillary, so it's important for our patient to be seated, comfortable, arms relaxed, or you could have your patient slightly raise up their arm. I'm gonna let her remain seated. So I'm looking at your lateral axillary. So if we have our axillary nodes, those are gonna be right in the armpit. So right in the armpit. The epitrochlear is going to be right near the elbow. And then our inguinal, it's gonna be right in the groin area, which I will get to when I'm doing our leg pulses and our leg joint of motion. I am going to move into your lung, heart, and abdomen assessment. So I'm going to require a stethoscope. I'm gonna keep you covered as much as possible, but privacy has been provided for our patient. I am going to reveal your chest just so I can get a good look. In order to separate our patient right and left, it's important to have some anatomy for chest symmetry. So I'm looking for trachea being midline, and then a couple of anatomical landmarks. We have our angle of Louis right up top. Your suprasternal notch is here as well. So suprasternal notch, angle of Louis, right a little bit lower. you have your suprasternal notch, and then your costovertebral angle is right here. Those landmarks help me move your chest into symmetry. I'm looking for inhalation and exhalation. I'm looking for any accessory muscle that's being used. So I am going to put my stethoscope in. Every time I move my stethoscope, can you take a deep breath in and a deep breath out? It's important to me to note your rhythm, your effort, and symmetry, listening to some tracheal sounds up top, bronchial sounds, bronchiovesicular, and then some vesicular breath sounds down below. So we're starting up top, and I'm going to be moving in a serpentine direction, comparing right to left, listening all over. Deep breath in, deep breath in, listening all over. These are some good bronchial vesicular sounds right now. Listening all over, even in the sides, this side, and then bring it into the middle. So I just listened to the lungs in the front. All of the lobes had clear breath sounds. Patient didn't have any strenuous effort or labored breathing, and rhythm and depth seemed equal. I'm going to go ahead and keep our patient sitting up, and I'm going to listen to the lung sounds in the back. Let's see if I can bring my phone with me. So if you have your patient sit up, this is a great time to also look at your patient's spine. Make sure your patient's spine is symmetrical. Looking for skin breakdown on the back of the neck, and right down here by the coccyx bone, another sign where skin breakdown can occur. So just like in the front, I'm going to have my patient take a deep breath in and a deep breath out every time I move my stethoscope, and I'm starting up top, doing the same thing, and we're just going to listen all over the back. Listening to the side. Place your patient back comfortably. So I listened also in the back. Breath sounds were unlabored. This is a great place to now start looking at your patient's heart. So they're still sitting up, so we avoid moving them up and down. With our heart, I want you to relax and just breathe normally. You do need to know the anatomical landmarks. So we have our aortic. This is the only one on the right side in the second intercostal space. Moving to the pulmonic, which is on the left sternal border in the second intercostal space. A little bit below that in the third intercostal space is Erb's point. Fourth intercostal space on the left side is our tricuspid. And then our mitral is on the left fifth intercostal space, midclavicular line. For our abdomen assessment, I am going to go ahead and lie our patient down. I'm going to be listening and taking a look to your tummy. I'm going to pull up your gown to keep you covered, and I'm going to bring my phone with me once I get you down. Is your tummy tender at all? Any areas of tenderness I should be aware of? So I'm going to go ahead and bring your gown up, and then just so I'm keeping her covered, but I do want y'all to be able to see. I am going to only be able to use one hand, but please practice the bilateral for our patient. So the first thing we do for our patient is take a look. So I'm going to actually come over here and take a look and make sure my patient does not have a distended abdomen, which it's not. It's pretty flat. No area is bulging. So after I inspect, and there's no areas of concern, I can move to auscultation. So we cut our patient's abdomen into 4 quadrants. Right lower is where we begin, moving into right upper, left lower. So I'm gonna start, we've already looked, now I'm going to listen. I should hear bowel sounds every 5 to 15 seconds. So I'm gonna start right lower, bowel sounds are auscultated, right upper, left upper, and then our left lower, moving in a clockwise direction. I heard bowel sounds in all 4, so I'm now going to lightly percuss. I would be doing this bimanually, but I only have one hand because my other hand is holding. So I'm going to lightly palpate your abdomen. I'm just going to lightly press. Let me know if you feel any tenderness. So I'm just going to lightly press here. Any tenderness? What about here? No areas of tenderness. I'm going to go a little bit deeper now. So a little bit deeper, no tenderness, no tenderness. This is a good place to also palpate the bladder. So bimanually palpate the bladder. Now we're going to, I can't really percuss, but it would be normal to expect tympany in the abdomen area. So you would lightly tap, tap over your hand, and we would hear gas or air. I'm also going to ask if they had, when's the last time you had a bowel movement? Was it difficult to pass? What was the consistency? What was the color? And then I would document those findings. I'm going to move this back. So we're done with our abdominal assessment. Oh, really quickly, I'm going to show y'all. This is also where we can do our inguinal nodes. So bimanually, you'd want to test the inguinal nodes. Also, your femoral artery, I'd be doing this bimanually. So femoral artery is also right near where the inguinal nodes are. I'm going to start my assessment of our patient's legs now. So I did just move my camera a little bit to show you all the legs so we can keep our patient covered. But it is important to look at our patient's legs and have them completely free from the blanket. Back of the hands, the dorsa, I'm going to be lightly testing for warmth and temperature of our patient. It should be warm bilaterally. I'm looking at my patient's legs. I don't see any lesions, no tattoos. Hair should be evenly distributed. I've already done my femoral artery, but I'm going to go ahead and do my popliteal artery behind the knees. You have your posterior tibialis done bilaterally on the inside of the ankle, and then your pedal pulse, which is right next to your big toe bilaterally. All pulses are 2+. Looking for signs of edema. This would not be here. So looking for signs of edema, which I'm not seeing any. There's no tattoos, no lesions, no wounds. Looking at the back of our patient's ankles for skin breakdown. Looking at our patient's feet, capillary refill. Our patient's toenails are evenly distributed and hygienic. Capillary refill on both. No signs of skin breakdown. You could get new gloves since you did touch the feet. This is also a great time to check for the remaining reflexes, which are our patellar reflex and our Achilles reflex. So again, with the reflex hammer, the patellar is done on our knees, and it can be done with our patient lying relaxed. With the bigger side, check the patellar. Whoa, so strong. And then for the Achilles on the inside of the ankle, whoa, and you do both. So, bonk. With range of motion, I would also want to have our patient push against me and pull against me. Can you go ahead and flex your toes, point your toes? Any pain? I'm going to check our patient's range of motion as well with their knees. I'm checking for crepitus with my palmar surface of my hand. Any crepitus present? No crepitus. I'm going to check their hip. So checking our hips, we're going to lightly pull against from the knees and do the same thing over here. Any pain or tenderness with your hip? With your hands, can you go ahead and pull me, push me? Hands, can you flex them? Right, left, spin them. Shoulders, can you turn your shoulder, spin your shoulders? With your neck, can you look up, down, side? Any pain or tenderness with our joints? With your temporomandibular joint, I'm going to go ahead and have you open your mouth, close your mouth, move your jaw side to side. No pain or tenderness noted. Glad to hear. This is when I'm going to have our patient actually get up and give me a sample of urine so I can test for their urinary assessment as well as their balance, gait, and their extremities bilaterally. Before I do that, I'm gonna make sure they have sensation. Just like I did above, here's a Q-tip. Please close your eyes. Let me know if it's sharp or soft. Soft, sharp, 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 soft. Same in your arms. Sharp, soft, soft, soft. So to have our patient safely give us a sample, go ahead and lower the bed. I'm gonna have you dangle your feet. Are you feeling dizzy? I'm gonna be right next to them as they stand up, so patient is standing up. Do you feel dizzy? I'm glad to hear. So I'm gonna have my patient go ahead and walk and give me a urine sample. I'm looking at their gait. Gait is steady. They're not wobbling. Their movement is coordinated. They're balanced. They're now back in the bed. My patient was a female, so I do not need to ask them about a testicular self-exam. But I am gonna go ahead and look at their urine sample, which is right here. I'm looking for the color, the amount. So color is a darker yellow. There's no particulate matter. I'm gonna ask our patient also if they had any trouble starting a urine stream or if they ever have pain or burning. She said no. I asked about the bowel movement and they said they already answered that question. This is a good time when you can kind of do your mental checklist to make sure you didn't forget anything. We did our cranial nerves.